So your time starts now.
Mhm. Yeah, I entered the room. I introduced myself. I'm Dr. Naresh, and this is my assessment sheet for the today's clinical station.
Okay. Good morning, Dr. Naresh. So you have to examine Adam. Adam is 6 years old, and you have to do his cardiovascular system examination.
Okay. Hello, Adam. Good
Hello,
morning.
doctor. Good morning.
How are you doing?
I'm fine.
Okay. Are you accompanied with your mother or your father?
Hello, doctor. Mother is saying hello to you.
Okay. Hello, mom. I'm Dr. Naresh. I'm one of the exam candidate for today's exam. Is it okay if I examine this, Adam, this heart?
Sure,
How?
doctor.
Thank you so much. Adam, I'm going to examine your heart, how strong you are, and if you feel any pain or any this thing, let me know. I'll stop my examination. Okay? Sounds good. Thank you. Okay, so can you please stretch your hands for me? Is there any? Sorry, is there any dysmorphism? I wash my
Mm,
hands. I wash my hands. Sorry, I forgot again. I wash my
okay.
hands and then I'll start this thing. Is there any dysmorphism?
No.
And what about the dimensions of Adam?
A bit small for his age, height, and weight.
Both. Okay. Any devices around?
No.
Any? Is the Adam is ill looking or a well looking?
Well looking.
Okay. Adam, can you stretch hands for me? Is
Stretching
there any
hands.
clubbing? Any clubbing?
Not present.
Not any cyanosis?
Not present.
Any pallor?
Slight pallor.
Slight pallor. Any? What about the peripheral circulation? CFT? Or the
Good.
nails? Good.
Good.
Okay. Any stigmata of the infective endocarditis in terms of Austin nodule James Way reasons?
Not present.
What about the pulse?
90 beats per minute.
It
Regular.
is regular. What about the radiator delay? Is there any? I'm going to check the pulse on both hands. Any radiator
Not
delay? Okay.
not present.
Okay. Is there any cannulation marks?
No.
What about the axilla?
Mm, nothing in exhale.
Okay. Can you please do like this for me? Any anemia?
Slight pallor.
Any jaundice?
No.
Okay. What about his mouth? What about the teeth?
Good oral hygiene.
Good horizon. Nothing else. Any high arch palate? Nothing else is
No.
there. I
No.
just forgot one thing in the initial. I got to check the water hammer pulse. Is there any water hammer pulse?
Not present.
Okay. Then I'll go to the inspection of the bed at the end of the bed. And before doing this thing, I'm going to basically take a permission from the exposure of the chest. Is Adam
Okay.
okay exposed?
Adam is just in his shorts.
Okay. And I'm at the end of the bed. Can you please let me know what about the respiratory rate?
20 breaths per minute.
Okay. If there is any this deformity in the chest,
No.
maybe pectus excavatum, carinatum, or anything.
No.
Okay. And
No.
now I'm the side of the bed. Is there any scar?
Not present.
Any rashes?
No.
Any okay. And any visible pulsations?
No.
Okay. Now I'm going to basically this. I'm taking permission from the Adam. Like I'm going to palpate it. Okay.
Okay.
So okay. So I'm going to palpate the apex beat. What about the apex beat?
Left side. Fourth intercostal space at mid clavicular line.
Mid clavicle line. What is the character of the apex beat?
Normal.
Normal. Then I'll go to palpate the P2. P2 is palpable.
No.
What about the trachea?
Central.
What about the parasternal heave?
Not present.
Not present. Okay. This completes my palpation in the front right now. Okay. Then I will go to basically look for the auscultation. I'm at the mitral area. What about the S1, S2?
Heard. S1, S2.
Any murmur
Mm.
on the apical area?
Murmur is present.
At the apical area.
Yes.
What is the character of the murmur? Systole or diastole?
Systolic murmur is present.
Systole. Is the murmur is throughout the systole or like early systole or
Yeah,
middle?
it is present throughout the systole. It starts with S1 and ends at S2.
S2. Okay. What about this intensity murmur?
Mm, grade 3.
Grade 3. Okay. Is the murmur radiating towards the axilla or an precordium?
No.
No. Now I'm basically at the tricuspid area. Is there any murmur here?
Yes, it is present.
In the tricuspid area also present.
Yes.
Same. What is the grade of murmur?
Here the intensity is more.
More. And
Mm.
is systole or diastole?
The same murmur.
Same murmur. What about the murmur in the pulmonary area?
It is present. This murmur is present all over precordium,
All over the
but
precordium.
maximum intensity lower left sternal edge.
Lower left sternal edge.
Sternal edge. Maximum intensity.
Okay. And aortic area also present.
Yes.
Does the murmur radiates towards the more in axilla?
No.
No. It's all over the chest. It's
Yes.
precordium.
3 minutes.
Okay.
3 minutes.
Okay.
Carry on. Carry on.
Okay. Now I will go ask Adam. Can you please sit for me?
Sitting.
Is there any scar, any rashes behind?
No.
What about the murmur? Does the murmur radiates toward the back?
No.
No. And then once actually I finish this examination, I would like to basically conclude my examination, asking the examiner. I would like to conclude my examination to look for the liver, to look for the lymph nodes, and to look for the edema over these limbs.
Okay.
Okay. So today I examined Adam, who is 6 years old. He's short for age and short for his height. I would like to basically plot his this weight and height on an appropriate growth chart. On my positive findings, what I found, he's having a mildly anemic, and he's having a murmur all over the chest. And the more intense the murmur is basically tricuspid area. That's a murmur is pansystolic murmur, and basically radiates throughout the precordium.
So what's your diagnosis?
I I I, I will put my diagnosis towards it's a pansystolic murmur, which radiates towards the whole of the precordium. So I will like to make this diagnosis towards the two things. It could be the MR or it could be the VSD.
Okay. So what is the most likely diagnosis out of two?
I will put this diagnosis towards the VSD.
Okay, right. So how you will manage this child?
I will like to basically like to take his full examination from the this head to toe with the examination plus history. As I told, I will already plot the height and the weight on curves of that. Let's take his vitals in form of this vitals, including blood pressure and saturation. And I would like to involve my consultant and the cardiologist. And I will like to make my investigation in the form of ECG, echo, and X-ray chest as of now. And
Okay.
once actually I'll come to know that it's a VSD, it depends on a VSD, the asymptomatic one or the symptomatic one.
Okay.
Okay. So according to I'll manage and I'll take this opinion from the cardiologist. That's more important.
So is this child in failure or not?
Because I have to check basically because the child is not in a failure because he's not ill looking and there is a no liver. You told I just asked this. I don't know whether you know liver is there or not. If the edema is not there. If the liver is there, edema is the definite child is in failure. But if the edema in liver, the child is not in a failure. If it is not in a failure, then actually simple basically observe the child and look for this what type the VST is here, is small, large. Accordingly, I will manage.
Okay. Right. So what advice would you like to give to mother?
I would like to give the advice to the mother three, four things. One is a nutritionally he should be good. There should be no tattooing. There should be no piercing. And one very important thing, the dental hygiene has to be maintained for the mother. That's very important. And to have a regular follow up with the cardiologist. And
Thank you,
accordingly,
doctor.
okay, thank you so much.
टाइम ओवर. ऐसे ही होगा सर एग्जाम में.
बोलो.
हम फ्लो में बोल रहे होंगे वो बोलेगा कि गेम ओवर. है ना. तो सर स्ट्रिक्ट मार्किंग करूँ या लीनियंट मार्किंग करूँ?
जो आपको करना है करो. मतलब आज मैंने वॉश किया हैंड्स. भूल गया था वो शुरू में वैसे मैं.
So as far as physical examination is concerned, 1 mark. It is borderline. And identification of clinical signs, yes, correct. Clinical reason, 2 marks, and rapport and communication style, that is also good. So I'll give you 7 out of 8.
Where one you cut? Where you one you cut?
In physical examination,
Like
because it is very important to auscultate the lungs for because in cardiac case we need to know
yeah,
whether the child is in failure or not.
yes,
We
yes,
have to look for Krebs, that is very important.
exactly.
two things in auscultation we need to check. First, whether the murmur is radiating to back or not, and second, whether Krebs are present or not.
Yes.
And you have to examine abdomen also, whether hepatomegaly is there or not. So that is also very important, because then only we will come to know whether child is in failure or not.
If I don't get a time, if I say to the examiner, that's okay, na?
Yes, sir. What happens is that in examiner, if bell rang at 6 minutes, the way it rang today, so what you will be saying is that I would like to complete my. सर ये दो बार बोला जाता है. I would like to, जो स्टैंडर्ड तरीका है ना उसमें दो बार बोलते हैं हम. I would like to complete my examination by plotting child's height and weight on appropriate growth chart. I would like to take saturation. I would like to take four-limb blood pressure. ये भी बोलना है. Four-limb
हाँ
blood pressure.
हाँ बराबर.
I would like to check femorals for any
Yeah,
radiofemoral daily. ये आपने नहीं बोला सर आपने.
yes, correct.
ठीक है. And I would like to auscultate lungs for any Krebs and palpate abdomen for hepatomegaly. इतना आपको बोलना है. जो आपने नहीं कर पाया, ये आपको बोल के कंप्लीट करना है, तब आपका एग्जामिनेशन कंप्लीट होगा 6 मिनट का. ठीक है. इसके बाद अब ये तो आपने एग्जामिनेशन खत्म किया ये बोल के, फिर आप बोलोगे टुडे आई एग्जामिन एडम इज 6 years old, he looks well, a bit small for his age, and I would like to plot his height and weight on appropriate growth chart. On cardiovascular system examination, he is a little bit pale, he is not sinus, he is not clubbed, he is not icteric.
नेगेटिव फाइंड से बोलनी है, नेगेटिव फाइंड से
हाँ
बोलनी है. नेगेटिव
सर ये तो बहुत इंपॉर्टेंट है. क्लबिंग साइनोसिस आप तो नेगेटिव बोलोगे ना, इंपॉर्टेंट नेगेटिव.
अच्छा ओके.
ये इंपॉर्टेंट नेगेटिव है कार्डियोवास्कुलर सिस्टम की, ये बोलनी है सर.
ओके
ठीक है. ही इज नॉट क्लब्ड, ही इज नॉट साइनोस्ड. ठीक है. ही इज अ बिट पेल, एंड ऑन cardiovascular system examination, I can hear a grade 3 murmur with maximum pansystolic murmur with maximum intensity in lower left sternal edge, and it is present all over the precordium, and intensity is maximum over lower left sternal with no radiation in it. So putting all these findings together, I have a 6-year-old boy with pansystolic murmur in lower left sternal edge for differential diagnosis, acyanotic congenital heart disease, and my differential is my first differential is ventricular septal defect. My second is mitral regurgitation. Then you will justify, and after that you did well.
Okay, thank you so much.
Okay, sir.
Yeah, I forgot the radiofemoral delay. I forgot the four-limb pressure and a Krebs. Yeah, yes. This is very important. Yeah, I agree.
Okay, sir.
Even you could have got the 2 marks, I would be happy.